Topic today. Very quickly, I don't pay a lot attention to all options, but what is present in crook. And topic it is benign tumors of female genitals. Guys, pay attention. Also present benign tumors of the external genitals, internal genitals. Так, милима. Так, I want to different types of tumors and depends on the character of the tissues which are in the structure of these tumors. Fibroma, usually it is connective tissues tumor. Yes, you see here the picture, large fibroma of on a theme tomb, usually smooth relief, mobile tumor in most of cases. No, to Crook test devoted to this topic, I never saw in Crook test. It is the photo you see of the fibroma. Usually diagnosis we set with the help of histological investigation. Usually decrease the level of collagen and very often has soft consistence. Maybe if it is present gyelanite tissues, it's maybe the dense consistence. It depends on the structure. And treatment all of these tumors, it is, you see, this kind of fibroma, yes. What characteristics? If we compare with malignant tumors, very slow growth of this tumor. Now here you see the tumor with necrosis, yes? You see the tumor with the necrosis. And treatment, it is removal of the tumor. Leiomyoma, it is tumor growing on the muscle fibers, primarily from the tissue of the labia majora. It's maybe leiomyoma, it is smooth muscles, and rhabdomyoma, which contain of transverse muscles. And again, leiomyoma, usually it is thick elastic consistence with elastic consistence formation, mobile, and very easy. We can remove this tumor from the labia majora. Elastic consistence. Lipoma, it is soft tissues because it is adipose tissues. Yes, also with the help of histological investigation, we set the diagnosis because sometimes it looks like as lipoma, but can occur that it is malignant tumor. That's why biopsy and then surgical treatment in most of cases. It's maybe hemangioma. You see here it is occur on the background of atelectasis of the vessels of the skin. Bluish, purple or red spots. They sometimes have the opportunity to grow very quickly. Maybe malignization. Diagnosis we set with the help of colposcopic investigation. We determine extended network of the anastomosis, sometimes varicose vessels. Usually also we perform surgical removal. Yes, in the young small girl, you see angioma of the labia majora. More popular method of treatment, it is cryotherapy. It's maybe with the removal of these cells with the help of low temperature. Electrocoagulation, it is opposite high temperature. Injection to the vessels, sclerosing agents, and sometimes radiation therapy. And treatment usually depends on the localization, extension of the spreading of the tumor, better to say, and the age of the patient, of course. A lymphangioma, you see here in the groins, usually localization, a lot of looks like as hamoche nodules, often merging in each other. Of course, consistence may be dense, may be soft, and surgical removal, it is possible. Papilloma, usually you know that papillomas, what Yes, they growth according to the presence of virus papilloma or human papilloma virus usually, and they have during pregnancy due to the influence of hormones, first of all progesterone, begin the very quick growth of these papillomas. Usually they localized around the labia majora, around anus. You see here two like gigantic papillomas, looks like as cauliflower, occupy different color from white to brown. In most of cases, it is benign, maybe malignization under certain conditions, but in most of cases, it benign tumors. No, not I cannot say tumors. It is warts, yes, formations. And of course, we use cryosurgery if small papillomas, maybe chemical agents, or maybe their thermocoagulation, but more popular it is laser therapy and cryosurgery in most of cases. If we have these large papillomas, first of all, we remove them with the help of the knife, and then we perform cryodestruction of the base of these papillomas. Hydradenoма develops from the sewage glands. Characterize it is young tumor, 15, 20 years old. Labia majora, pubis may be present localization. Size, it is 0.1 to 1 centimeter, and maybe pink, maybe yellow, maybe brown, and also we remove this tumor with the help of the surgical treatment. Vaginal cyst, very specific and very rare cyst of Hartner duct. There are possible simple mesonephral and paramesonephral cyst in the upper section of the vagina. It is rudiments which stay after the development of the embryo. Yes, usually very rare we can see this cyst. Maybe adenosis, multiple cyst of the vagina. Very difficult to remove this cyst because it is a great risk to make the trauma of urine bladder, of the organs of the urinary system. And in order to remove this cyst of Gardner duct, need to be doctor of the high qualification. About Bartholin cyst, I have told you, and guys, only I want you to remind what we do. If it is cyst, we perform operation which we call marsupialization. You see, it seems that we created artificial duct. We make the inversion of the wound and suturing of the margins of the wound to the healthy mucosa of the labia minora. Yes, and in this case, the recidive cannot happen. If we don't perform marsupialization, some time pass, and then again appear the cyst of Bartholin gland. And I told you that you need to repeat the benign tumors of the uterus, and first of all, leiomyoma. You need to understand that we count the size of leiomyoma according to the weeks of pregnancy. Uterus increase as 6 weeks of pregnancy. Body of the uterus increase as 12 weeks of pregnancy. It does not mean pregnancy. It means the size of the uterus. I want to say in our hospital, most of our operation, it is operation in women with leiomyomas, which occur after 35 years in most of cases, diagnosed in 15–70%, but I want to say that very prolonged time, fibromyomas at all, especially if they localized in the muscles of the uterus, they did not give us any symptoms. And that's why I want to say to my mind, this percent is very decreased, because the woman who has fibromyomas more than statistics told us, because I told you that we don't pay attention to this. They don't. The women don't visit a doctor if there is no evident symptoms. Usually on the base of pathogenesis of development of fibromyalgia, it is the disorders of metabolism of sex steroids. First of all, the level of estrogen, testosterone, and estriol is dominated in the follicular phase of the menstrual cycle, and estriol on the background of reduced secretion of progesterone in lutein phase. In both phases, we have the increased the level of estrogens. Usually, most of the theories explain the development of fibromatosis nodes as hormonal disorders. No, you see here, it's maybe violations, another theory of peripheral hemodynamics and water electrolyte balance, impairing of the blood flow, increasing the concentration of the potassium in the blood, maybe. Then you see another modern theory which described in many articles in recent years, found that to the development of the uterine myoma lead biologically active substances, so-called growth factors. In particular, the level of epidermal growth factor, which contain both stromal and epithelial cells in the muscle tissues, exceed many times if it is uterine leiomyoma. Yes, concentration of epidermal growth factor increase, but we don't know the reason why this factor increase if we speak about the fibromyomas. A lot of theories, no one's explanation, but guys, you need to know that usually it is the woman after 35 years. And I want to say, if the woman in a perimenopausal period around the climax, around the menopause, we have the decrease of size of fibromyoma, and we have decrease of all symptoms of fibromyoma. And sometimes, if we have no indications for operation, anemia, quick growth of the tumor, necrosis, maybe spontaneously we have decrease of these nodes, and they don't trouble the woman in the climacteric period. If it is small site, possible conservative management in this case. Very significant for clinical picture of fibromyoma, it is localization of the fibromatous nodes, and we have even classification according to this. Typical localization, it is the body of the uterus, but to my mind here you see fibromyoma near the cervix, it is cervical fibromyoma. Then it's maybe no, here this is cervical fibromyoma, and this is the diffuse increase of the body of the uterus. Here we have the fibromyoma of the body of the uterus. Localization, very significant for us, the growth of the tumor. And according to these localizations, sometimes we make our decision about our management. If we can manage the woman with the help of conservative methods, or we need to perform or suggested operative treatment. In some cases, it is better than to manage the woman with the help of conservative methods. And I will explain you why. Maybe you know, guys, maybe you know. For example, what can you tell me about the intramural fibromyomas, guys? Somebody know? What are the clinical picture? You see, it's maybe intramural fibromyoma, it's maybe subserose when node cover with serous membrane of the uterus, yes? Then it's maybe submucous and this is also submucous localization of the fibromatous node. And also we have subserose, this node cover with serosa, subserose node, but this node has the needle or leg or pedicle. In literature every time, maybe pedicule, my better to say, subserose node with the pedicule. Guys, if we speak about them, and maybe very rare localization intraligamental, usually it is subserose nodes on pedicule, which located between the sheets of the broad ligament, for example. Or maybe inside other ligament can be localization. Nascent fibroid, you have Krog test devoted to this. You see that fibroid growth, it is submucous fibromyoma. This node covered with internal layer of the uterus, mucous layer, yes, and that's why we name this submucous fibromyoma. I want to say that maybe submucous node without needle, without pedicle, or maybe with pedicle. Sometimes fibromatous node begin growth inside the uterine cavity toward the cervical canal, in direction of the cervical canal. And if the size of the tumor is very large, or for example, if the tumor has long needle, during any physical efforts of the woman, this tumor inclinated in the cervical canal and begin dilated the cervical canal. In this case, woman feel the pain which is like a labor pain, yes? She feel as contractions of the uterus, because I want to say first period of labor, why it is so painful? Due to the dilation of the cervix and contractions of the uterus, yes? And during dilation, woman feel this pain, looks like a labor pain, cramp like pain, maybe. And if it is long needle, this fibroid can be born through the cervical canal, and you have the test in Krog test when the woman came to us with pain in the lower. Извините, ребята, сейчас one minute, please. Кать, он звонил, он хотел тебя видеть на метод совещания, но оно уже прошло. И спрашивал, поручил мне, просто я, как знаешь, козел отпущу, поручил мне спросить. Ты написала объяснительную, отдала Татьяне. Все, тогда поэтому, если он будет спрашивать, значит, так я знаю, что ты написала, но я ж тот день... Да ничего, он, спросить у нее, я думаю, ну мало ли, я ее не видела сама, а Татьяны нету. Все. Ну, он хотел тебя, не в этом вопрос был, он хотел тебя видеть просто на метод, ну да, недобрый. Нет, нет, вообще, потому что там один не пришел, другой должен был сделать, не сделал, ну, такое. Ну, и тут же метод совещания вчера, ну, говорит, орал, говорит, пиши объяснительную, сорвал, потому что не подготовил. Сегодня, вот, сегодня все хорошо, но он просто тебя искал, сказал, что ты должна была быть на вот этом, не, он не сказал, что плохая, должна была быть, ну, вот все тогда, если вдруг увидит, будешь знать, все, пока. Все, хорошо, или там спросит что-то. Но Татьяны некому, он еще не себя был, потому что она ключ унесла, на кафедру невозможно попасть было. Мы в кабинете совещания проводили. Вот такое. Ну ладно, все тогда, все. Ну вот именно. Нет, он говорит, она сама должна знать, что метод совещания. Арал уже сделал рассылку. Ну все, ладно, все тогда, пока. Guys, excuse me. And this fibroid can be born, yes. And how in Krog test they describe this situation, that women came with cramp pain in the lower abdomen, bleeding, and urine palpation, bimanual investigation, we palpated the cervix with dilation, and we palpated tumor-like formation in the cervical canal. Usually, maybe nascent fibroid, but I don't understand this term. Fibroid which can be born through the cervical canal. Yes, what do for the management if it is this fibroid? We can grasp with fibroid with the help of tenaculum or mesoforceps, it is obstetric forceps, and make the torsion of these fibroids and remove the fibroid through the cervical canal. Sometimes it is impossible if we have large fibroid and short needle. Yes, in this case, we need, if our efforts, we have the failure efforts, we need to perform hysterectomy. Usually, it is submucous type of myoma, fibroid with a pedicule, and usually, very often, it can be born through the cervical canal, and possible small gynecological operation, torsion of the fibromatous node. You know this. To my mind, one crook devoted and answer nonsense fibroid, another crook is devoted to the management. It is retorsion of the torsion of the fibromatous node. You see here again different kinds of fibromes, intramural, subserous, guys, fibroid which was born, you see in the vagina fibroid, yes, fibroid submucous in the uterine cavity, and it is also submucous node. Localization is not so good because usually it deformates the cavity of the uterus and can cause different complications. First of all, it is bleedings. Pain syndrome may be present, and I want to say if we have this kind of of submucous fibromyomes, very difficult to perform if the woman came to us with bleeding. How we can help? First of all, bleeding due to the hypertrophy of the mucous layer of endometrium. Yes, mucous layer, internal layer of endometrium. And first, which we need to do, we need to perform curettage, remove this bleeding mucosa, uterus slightly contracted, and bleeding usually stopped. But if we have submucous localization of these nodes, very difficult to remove mucosa from these parts of the fibromatous node, from this part, upper part of this submucous node, and that is why sometimes curettage, our small gynecological operation, cannot help in this case, and we need to perform hysterectomy, even if this submucous nodes is very small. That's why usually it is submucous localization with deformation of the uterine cavity. Usually it is first symptoms, it is bleedings. Bleedings which cannot stop, which begin maybe during menstruation, cannot stop, maybe sometimes bleedings which occur in middle or in another time of the menstrual cycle. But usually it is the specificity of hyperpolymenorrhea. It is bleedings during menstruation, profuse, prolonged menstruation, and sometimes continuous menstruation. If we speak about this kind of what are the main symptoms, manifestation? Menorrhagia, you see here, it is heavy prolonged menstruation. If it is submucous nodes, guys, I told you, yes. Metrorrhagia, acyclic uterine bleeding, often at the intramural localization of the tumor. This intramural localization, very often they are asymptomatic at all. But if the tumor occupy and large size, have a large size, maybe pain, maybe disorders of nearest organs, first of all, frequent urination, constipation maybe because urine bladder and rectum are near the uterus, and maybe also pain syndrome, and appear a cyclic bleeding. Uterus after menstruation cannot contract it in enough muscles due to the presence of this fibromatous nose, appear a cyclic bleeding. Present pain in the lower abdomen, uh, and violation of adjacent organs. I told you about it. If it is subserous localization of the fibromatous nodes, sometimes women feel pain. We name this symptomatic fibromyomes. Sometimes even small size of fibromyomes can give us pain syndrome. And in this case, we set the diagnosis symptomatic leiomyoma. It's maybe torsion of the fibromatous node, and we, in this case, receive the necrosis of the fibromatous node and clinical symptoms of irritation of the peritoneum. In our books, it names acute abdomen in gynecology. Maybe necrosis of the fibromatous node if it is intramural localization. Due to the violations of blood supply, begin necrosis, and also appear the clinical picture of necrosis of the fibromatous node. More thoroughly, we will speak about it if we have the topic acute abdomen in gynecology. See, here you see, yes, violations of blood supply, and you see intramural fibromatous nodes, incision, and this is a fibromatous node with necrosis. Diagnostic. First of all, the main it is be manual examination. Why it is the main? Doctor with the help of his hand feel the consistency of the uterus, yes, then size of the uterus can feel, determine if it is painful investigation or painless investigation. Guys, we have 9 minutes, and after this we will meet at let's meet at 10 and 50, guys. 10 and 50. I went to another, wait for you on another conference.